In the past 20 years, one thing has reduced child mortality by half. That's vaccinations. But since the coronavirus outbreak, many countries have suspended their immunisation programmes, putting 80 million babies at risk. Preventable diseases like measles, polio, cholera and diphtheria were slowly being wiped out. But the World Health Organization is now reporting outbreaks of measles in Cambodia and Nepal and clusters of cholera in Ethiopia. There are fears the hard-won gains may be eroded.
We cannot exchange one deadly outbreak for another. We cannot afford to lose decades of health gains that everyone has worked so hard to achieve. We need joint concerted efforts to put vaccinations back on track. And there are many ways we can do this.
World leaders pledged $8.8 billion at a virtual vaccine summit to ensure some 300 million children between now and 2025 get the protection they need.
Our pledge today is $300 million Australian dollars.
Also on the agenda, how to make an eventual vaccine against COVID-19 available to those who need it most, not just the countries who can afford it.
I would like to announce the launch of the COVID-19 Global Vaccine Access Facility, or COVAX facility as we're calling it. Participating countries will receive access to a portfolio of vaccines procured by the facility and based upon an allocation framework and at a negotiated price.
The race to find a vaccine is unprecedented. What usually takes 10 years is being attempted in 18 months. 2 laboratories are pulling ahead of the pack with small but successful clinical trials. Oxford University is testing its vaccine on 1,000 volunteers, while a US biotech company, Moderna, announced its vaccine had already generated antibodies in 8 volunteers. Whoever does develop a successful vaccine stands to make millions. Despite calling for a new era of global health cooperation at the summit, the UK and the US have refused to back a WHO initiative that would make an eventual vaccine patent-free. Both countries have already reserved millions of doses of the future vaccine. But the UN is warning against vaccine nationalism, because with coronavirus, unless everyone is safe, no one is safe. Charlie Angela, Al Jazeera.
Annie Sparrow is an assistant professor of population health science and policy at Mount Sinai's Hospital at Icahn School of Medicine. She joins me now from Geneva. Good to have you with us again on the programme, Ms Sparrow. I mean, how important has this pledging conference been, considering we are in the middle of this COVID-19 pandemic?
Well, one of the things that is clear, and this happens with every outbreak, is that the death toll from non-virus is much greater than that from the virus. And this particularly affects children, where we see for every 1 COVID death in adults, there's 100 deaths from vaccine-preventable diseases. And there's probably 1,000 deaths if we look at other diseases such as malaria, TB and HIV, which are slow ongoing pandemics. So, and looking at these diseases like measles, which last year killed 10 times as many kids in the Congo as Ebola did, then we've had these vaccines for 50 years. So we should have we should have been able to eradicate measles by now. And indeed, there was a fantastic WHO push to do so, which has also been derailed by the COVID pandemic. But I think what's really important is that we need just as much as vaccines, we need public health and we need primary health care.
Indeed. Where do you need to focus now the money in terms of not just buying the vaccines, but what type of vaccines and which parts of the world need them most for which diseases?
Well, certainly measles is still a global killer. And as was pointed out, we are having outbreaks not only in sub-Saharan Africa, but also we've seen them across the US and North America, in Cambodia, in the Ukraine, in Italy. And as a disease which not only has a significant death toll, but an ongoing morbidity, that's a really important one to focus on. But this is not the last pandemic, and we need to make everyone a little bit stronger and more resilient, because putting all of our money into the COVID vaccine doesn't prepare us for the next vaccine or the next pandemic or the one after that. So I think we have to be really smart about this and look at vulnerable populations, and that certainly means sub-Saharan Africa, it means Southeast Asia and Latin and South America, and focus there. We need to get kids back to school where we can have school lunches and nutrition programs and sport programs and even do vaccine programs from schools and mass deworming and all of the other diseases that contribute to making us, much stronger in the longer term.
Well, for your time, thanks very much. Annie Sparrow there from the Mount Sinai Hospital Icahn School of Medicine. Thank you.